I'm doing well, and yourself?
Not too bad. So today we are going to do an assessment of your lungs, your heart, and your abdomen. So we're going to start out with your lungs.
Okay.
So can you pull your shirt up for me? So to inspect the chest has a normal male pattern hair distribution. It rises and falls symmetrically. The shape is round. Color is pink. Respiratory pattern is regular and breaths are not shallow. So next I'm going to come behind you. If you can leave your shirt pulled up, I'm just going to put my hands on your back. That works too. Okay, so I'm just going to make a W, squeeze, and if you could just breathe in and out normally a couple times. So thoracic expansion is symmetrical on each side, and my hands rise and fall symmetrically with each breath. So I'm next going to check for tactile fremitus. So I'm going to put my hands on you like this, and every time you feel my hands move, say 99.
Okay. 99, 99, 99, 99, 99, 99.
Okay, so tactile fremitus is notated on the ulnar surface of my hands in both lung fields. So next we are going to listen to your lungs in the front and the back, anteriorly and posteriorly. Just take some deep breaths. Okay, so lungs in the front are clear bilaterally. Do the posterior. Some more deep breaths. So lung sounds are clear bilaterally. So next we are going to tap on your back for a diaphragmatic excursion. And I'm going to write on you with a pen and measure to see how far your diaphragm rises and falls.
Okay.
Okay, so can you take a deep breath in and hold it? Okay, and breathe normal. And then take a deep breath in, and when you blow the air out, just hold your breath. Okay, you can breathe normal. So to measure it, I got 3 centimeters, and 3 to 5 is within normal limits. So your diaphragm rises and falls within normal limits. So next we are going to percuss your lung field and actually tap on your lungs in the front and the back. So you can just sit up straight and breathe normally. So the sounds on the anterior are resonant. Posterior, and breathe normally. So lung sounds posteriorly are resonant as well. So everything with your lungs sounds normal. Next we're going to do your heart. So first I'm just going to inspect your chest. So when you breathe normally, there's no heaves, lifts, or thrusts noted. Next we are going to feel your chest for the point of maximum impulse. So at the PMI, I can feel your heart beating regular rhythm, not fast. So next we are going to listen to your heart in all of the corners of it. So first we'll deal with the diaphragm and the bell. So first is the aortic, and that is the second intercostal space, right clavicular line. Next is the pulmonic, which is the second intercostal space, left sternal border. Next is the Erb's point, which is the third intercostal space, left sternal border. Next is the tricuspid, which is the fourth intercostal space, left sternal border. And last is the mitral, and that is the fifth intercostal space, mid-clavicular line. So there are no murmurs noted, and your heartbeat sounds regular. So we're going to take a break and scan the room really quick, then we'll come back. Okay. So next we are going to palpate your pulses, a couple of them. So first is the temporal, and then the radial, and the brachial, and then the lower extremity ones are the popliteal behind your knees. Pull your hips like that. And then the posterior tibial and dorsalis pedis. So all pulses were noted to be strong and bounding. So next we're going to do the abdomen. Put your hands back down. So if you want to lay down on the table, so on visual inspection of the abdomen, the skin, there's no striae, no varicosities, no umbilical hernias, normal male pattern hair distribution. The umbilicus is small and midline. Next, we are going to listen for bowel sounds in all four quadrants. abdomen. I'm not going to press on you, I'm just going to tap on my finger. So on percussion of the abdomen, it is resonant. Also, when you were listening to the vowel sounds, there was no friction rubs heard over the organs. We will auscultate the arteries as well. So this would be the renal, iliac, and then femoral. And there are no bruise or friction rubs on the arteries. So next we are going to feel your liver and measure it. So on measuring your liver, I got 9 centimeters, and between 9 to 12 is normal. So your liver is normal size. So next we will feel your spleen, and that is on this side. So I am going to put my hand here. Now you take a deep breath in and out. So the spleen was not palpated. Did that hurt?
No, ma'am.
So that is within normal limits. And next we will feel your liver. Okay, we'll take another deep breath in and out. Did that hurt?
No, ma'am.
Okay, good. So there was no bulges, masses, or tenderness noted on palpation of the liver. So next we will do the kidneys, and the same thing. I'm going to put my hand in the small of your back and push down. Take a deep breath in and out. Any pain?
No, ma'am.
Same thing on the right side. So there's no bulges or masses noted on the kidneys. Any pain on this side?
No, ma'am.
Okay. So the kidneys are normal. So all of this is done on both sides, assuming that your body is symmetrical. So if we didn't do it on both sides here, you can assume that I would have on a patient assessment.